Assalamu alaikum wa rahmatullah. Welcome back. It is Ramadan. May Allah subhanahu wa ta'ala accept from you, from us, and from our loved ones all together. Our devotion in fasting, in reciting the Quran, in dhikr, in carrying out all sorts of righteousness. May He grant us the strength to continue with that righteousness beyond Ramadan until next Ramadan. And may He grant us a good ending as Muslims. Allahumma Ameen. When the Muslim fast, things happen during the fasting day. It could be blood cupping, which is called hijama. It could be having to take injection. It could be having to take ice drop, nose drop, ear drop, and what have you. It could be many other things. Today's video is about what is the ruling regarding performing cupping or sucking out blood from the body of a fasting person. As far as the Sunnah is concerned, there are two camps. The camp that opines that cupping and performing hijama while fasting is totally fine, and the camp that says that performing hijama while fasting should not be done. The first camp is the camp of the Jumhur, the camp of the madhab of Abu Hanifa, the madhab of Imam Malik, and the madhab of Imam Al-Shafi'i. The evidence is what Al-Imam Al-Bukhari rahimahullah ta'ala reports in his Sahih, that our beloved Rasulullah sallallahu alayhi wasallam has allowed cupping, hijama, to be performed on him while he was in ihram and also while he was fasting. Therefore, performing hijama or blood cupping while fasting is fine. Rasulullah sallallahu alayhi wasallam has done it. Also, Alqama radiallahu anha did narrate that they, women folks, used to perform hijama before Sayyida Aisha, our mother radiallahu anha, the wife of the Prophet sallallahu alaihi wasallam, while they were fasting. And Aisha never gave any remark or stop them from doing it, which indicates that it is fine. This is the camp that opines that hijama or cupping is permissible while fasting. The other camp that opposes that is the camp of Al-Imam Ahmad rahimahullah ta'ala, that opines that cupping is not permissible while fasting, and their opinion is based on a hadith from Ibn Majah in which Rasulullah sallallahu alaihi wasallam says, "Aftara al-hajim wal-mahjum," the one who performs hijama on someone has actually broken or invalidated his fast, and the one for whom hijama is made or performed has also invalidated his fasting. However, the evidence of the Jumhur, who opine that performing hijama while fasting is permissible, they base on the fact that this happened later than the time when Rasulullah sallallahu alaihi wasallam made the statement "Aftara al-hajim wal-mahjum," which means the doing of the Prophet came in a later time. Therefore, it overrides the narration or the relation that he has said that "Aftara al-hajim wal-mahjum." So based on authenticity, both camps have authentic relations. However, the relation of the camp of the Jumhur overrides the camp of Al-Imam Ahmad ibn Hanbal, simply because this happened later than this. Now that we agree to adopt the opinion that permits cupping or hijama while fasting, we have to know that it comes with a condition. That is, the hijama while we are fasting should not cause us to be weak, which may lead us to break our fast. As a fasting person, you should know yourself better. If you know yourself that you cannot stand hunger or weakness, then it is better to postpone cupping or hijama until one breaks his fast or until when one is not fasting. So as long as it does not make you weak and cause you to fall sick and want to break your fast, it should be fine to perform hijama or to perform cupping. But the weak person should stay away from cupping while fasting. This is the interpretation of the hadith which was adopted by Al-Imam Ahmad, "Aftara al-hajimu wal-mahjum," that the cupping causing weakness to the fasting person is actually a cause for him to break fast. Therefore, even the one who performs it on him also break his fast. This is ta'wil, right? Now, what is applicable to blood cupping, hijama, is also applicable to blood sucking or blood donation. Blood sucking for laboratory test or medical test, or for blood donation. For medical test, if the amount of blood usually will not be big. For blood donation, usually it comes in a big quantity. If the person knows himself that he has weakness, then he should stay away from blood donation while fasting. But if a person is strong, Allahumma barik, then he should be fine to go. This is in normal situation. In emergency situation, where there is an emergency case, someone is dying, someone is losing blood, someone is in dire need of blood donation, and there's no anyone who can donate their blood except your good self or anyone around, and the person happens to be fasting, then he should be able to volunteer and donate his blood, even if it causes weakness. When that happens, he is allowed to break his fast and make up for that fasting day after Ramadan, inshallah ta'ala. So that is it in summary with regards to blood cupping, hijama, taking blood for lab tests, or even taking blood for blood donation purposes. In our next, by Allah's will, we will discuss taking an injection while fasting. Until then, may Allah subhanahu wa ta'ala grant us what it takes to better and purify our dunya for the best interest of our akhirah. See you and see you in Jannah. Wassalamu alaikum wa rahmatullah.